Okay, hello everyone and welcome. It's an honor to be here today to welcome you to this ADEA Chair of the Board Symposium, Harnessing the Oral Health Profession to Tackle the Climate Change and Health Crisis. My name is Cecilia Sorensen and I am the Director of the Global Consortium on Climate and Health Education based at Columbia University. So we have a really exciting program lined up for you this hour, but before we get started, I'd like to invite Dr. Nadir Nadershahi, who is the University of Pacific Arthur A. Dugoni School of Dentistry Dean and the Chair of the ADEA Board of Directors, to join us on stage and to provide some opening remarks. Thank you so much.
There you go. Well, good morning. It's great to be here. Thank you for taking the opportunity to join our first Chair of the Board Symposium. I want to thank our speakers and our panel for making the time to be here. As chair, you get to pick a few topics that you want to elevate, and as you heard, if you were in the opening plenary, this was one that I know is important to all of our speakers and all of our students and residents across the country. So I appreciate you putting the time into doing this. Some of you may have seen from the Climate Action and Academic Medicine report that it's estimated that 8 to 10% of greenhouse gas emissions in the US come from healthcare. And globally, that could be, those estimates are as high as a quarter of them. So the impact that we as healthcare providers have on the climate is really important, and having an understanding of the impact of climate on all of our health. So I'm really grateful for our speakers. I hope you enjoy the program, and thank you again for making the time to be here. I'll turn it back over to you. Thank you.
Thank you so much. Thanks. Okay, thank you for those opening remarks. It's such an honor to have you here. So we have, oops, which way am I going? We have an incredible lineup of speakers here today who are going to share with you their perspectives on climate change, health, oral health, and education. But we also have you, and we have the group of us here today to get through these learning objectives. So this is going to be sort of a participatory event, and so we invite you to kind of get up to the mics, to use the Mentimeter, and to really be part of this event today. So we have no speaker disclosures to declare, so with that, we are going to get started. All right. So over the past 10 years, you might or might not have been aware that we have been seeing mounting evidence and increasing reporting in the news of how climate change is affecting health globally as well as locally. For example, rising temperatures and heavier rains are leading to the spread of malaria in Africa. India is facing one of the most severe heat waves in recorded history. Unprecedented flooding in towns and cities in Western Europe and in Pakistan. Here in the American West, a rapid increase in the frequency and acreage burned by large wildfires. We've been seeing forced migration globally as well as locally as a result of environmental degradation. In fact, the World Health Organization has called climate change the single biggest threat facing humanity. So truly, all life forms on this planet are being impacted by climate change, including polar bears. And polar bears are really, our poster child for climate change. But as we know, over the past several decades, we've been seeing this lens shift from polar bears being really, the poster child for climate change to our health being really to the forefront of this, the health of our children and the health of our grandchildren. And the tolls on our health and the well-being of our societies are being felt. So just in 2022 alone, there were over 18 disasters in the United States, each which led to over $1 billion in property damage alone, showing us that although climate change will affect all of us, those in communities most vulnerable to its impacts stand to lose the most. So here in this graph, we are looking at the past 40 years of billion-dollar disasters in the United States. And what we're seeing is a rapid escalation in the numbers of severe storms, of droughts, of wildfires, and other events that are driven by climate change. You can see here that I believe it was 2020, there was a total of nearly $500 billion in property damage alone, and that's not even beginning to account for the health impacts of this. We also know that as health professionals, we're faced with this paradox. So in addition to doing a huge amount of good in the communities we serve, our systems inadvertently do harm. So we know that if the global healthcare sector were a country, it would be the 5th largest emitter of greenhouse gases on the planet. And so we've got a lot of work to do to rectify this. We also know that health systems are highly vulnerable to the impacts of climate-related events, as we've seen with hospitals' closures and evacuations during disasters. Our best science from the Intergovernmental Panel on Climate Change is telling us that climate change is a code red for humanity. Right? They're not saying this is a code red for the polar bears. They're saying this is a code red for humanity. And code red, I think, is really important to key into. This is talking to us as health professionals. It's trying to get our attention. And we know that from this IPCC report that these impacts are already being seen. So this is a slide which was created by our US CDC, which is illustrating how increased temperatures, more extreme weather, rising sea levels, and increasing carbon dioxide levels are directly contributing to exposures. Things like extreme heat, more severe weather, air pollution, water and food quality impacts, changes in vector ecology, which result in direct health impacts to us, to our communities, and to those globally. In this figure, we are looking at observed impacts on human systems. So this is from the IPCC, so just to kind of cue you into how they're coding this, the darker the circle, the more evidence or certainty we have that these impacts are occurring and that they're attributable to human-caused climate change. So what we can conclude is that our best science is telling us that climate change is already undermining human systems across the globe, which are vital to stable and secure livelihoods, including water security, agricultural production, livestock and fishery yields. In the middle here, we're looking at direct impacts on human health through infectious diseases, heat exposure, malnutrition, of course, mental health, resulting from things like forced displacement. And we know we're seeing escalating impacts on human cities, settlements, and infrastructure, and that includes essential health infrastructure. Our best science is also telling us that climate change is worsening health inequities and disproportionately impacting groups of people who are economically and socially marginalized. So for example, nearly 2/3 of the morbidity costs are currently being shouldered by Medicare and Medicaid patients. And new research from the World Bank Group tells us that up to 132 million new people will be pushed into extreme poverty by 2030 as a result of climate change. Now, this is a lot of bad news. It's hard news. And I think as health professionals, we deal with hard news a lot. So, I think we all need to be deploying our sort of internal mechanisms to deal with hard news. But we know as health professionals that hard news and a difficult prognosis does not stop us from taking action, because we have a silver lining here. We know that the severity of climate-related health risks is highly dependent on how well health systems can protect people. So these impacts that I was just talking about, these are not inevitabilities. We as a health sector, we as health professionals have a huge capacity to step forward and to start buffering these impacts in our clinics, in our communities, and beyond, using our voices and our action. So The Lancet recently argued that climate change is the biggest global health threat of the 21st century, while at the same time, tackling climate change could be the greatest global health opportunity. However, if we are going to turn this risk into an opportunity, we need health professionals who are prepared, who are knowledgeable, who are educated, how they can prevent and respond to its impacts. And our potential to create impact is huge. I just pulled this data from the World Health Organization. So in total, there are nearly 50 million registered dentists, doctors, pharmacists, and we're not even nurses, and we're not even thinking about the broad range of allied health professionals who are part of the health sector. We are enormous, and we are in every community down the last mile of care. We are there, and this is where we have the potential to act. And so none of us can do this alone, right? This isn't just the job of oral health professionals or just the job of social workers. We need to work together. We need to work in our own specialties, and we need to be able to collaborate with other specialties to be able to create change in our communities. And so as health professionals, we have incredible ways in which we can act, right? So we're clinicians, we're researchers, we're trusted community voices, we're institutional leaders, and we're also private citizens. And in each and all of these roles, we have opportunities to act, small and large. So I've been told that written in Chinese, the word crisis is composed of two characters. The first character represents danger, and the second character represents opportunity. So today, you are about to hear from some fantastic colleagues who are really finding the opportunity in this crisis and leading the way. So with that, it's my pleasure to introduce Dr. Donna Hackley, who is an assistant professor of oral health policy and epidemiology at the Harvard School of Dental Medicine. Thank you, Donna.
So good morning, and thank you, Dr. Sorensen. It's really a pleasure to be here with you today. And I don't know if she mentioned at the start, she's the director of the Consortium for Climate, Health, and Education at Columbia University. So I feel very fortunate and blessed to be here with you. I also want to say thank you to Dr. Chan for beautifully handling all the logistics to make today possible. And most importantly, I want to thank Dr. Nader Shahi for embracing this topic of sustainability in dentistry and choosing it for the Board of Directors Symposium today for the 2023 ADIA annual session. So thank you for making that possible for all of us. I'm humbled and honored to be a part of a panel with colleagues and future colleagues who are going to speak shortly, and to be with all of you. I think we're going to have great discussion today, so thank you for being here and spending time. I want to frame the topic of sustainability in dentistry by considering three basic questions. How does climate change affect oral health? How does it affect oral health practicing? And what is the role of the dental profession? And how can we integrate this into our education? This is a website from the National Institute of Environmental Health Science, and they've curated a body of literature relating climate and health outcomes. And you can search here, and there are, of course, the other searches that you run as well. And we can find some literature linking oral health outcomes to climate. Now, you can see I've listed them here, a few that I found, and various specific oral health outcomes are being shown to be associated with environmental exposures for which the driver is climate change. And if you just take a look at one in particular, the last one, you'll see that that's a mosquito-borne disease. Now, with climate change and global warming, vectors like mosquitoes and ticks will have longer lifespans, and they'll be able to survive in wider geographic areas. So it's very possible that we will start to see oral presentations of things that we've never seen before. Now, in terms of climate change affecting our practice as oral health practitioners, we can focus on a couple of these points. For example, resiliency. Is our practice resilient in the face of an adverse weather event? If we're flooded and we have no power, how can we communicate with our patients? Where are our records? How can we handle emergencies? If we're shut down for days or weeks or longer, how can we take care of our patients? How is the financial stability of our practice if we're not generating any income? Prevention is a key piece, and we need to strive for ever better prevention so that there's less disease needing treatment. We need to maximize our use of teledentistry, treatment planning so that patients are coming the minimal amount of times to the office, and perhaps scheduling families together to cut down on the carbon footprint of transportation, and materials and waste. These will all be affected. Our decisions on which materials and how we process our waste are all ways that climate change will impact the way that we practice. So the role of the dental professional, I think we can look at it in four basic categories. And in terms of taking action, I really love this website, Practice Green Health. You can click on any one of those bubbles and it will open up, whether it's water, water use, energy, carbon footprint, and it will open up and offer you a tremendous amount of evidence-based literature, toolkits, connections to support mechanisms, and they've been tracking hospitals, more than 350 hospitals, who are implementing various initiatives to address their climate impact and tracking the metrics that are coming from these initiatives. And that data is available there for you, for all of us to see and to leverage as we try to institute changes at our various locations. Now, specifically for oral health professionals, the World Dental Federation has offered up 4 domains where oral health professionals can find practical, realistic, effective means of mitigating our impact on the environment. I touched on prevention already, and operative care, using the best materials that we can and using them well, right? Integrated care, that's relating to how we're scheduling patients, how we're creating our treatment plans, and how we're integrating oral health with primary care. And lastly, the one I find most interesting, actually, is ownership of care. And what they're encouraging us to do there is to self-evaluate, reflect, audit ourselves. Does the work that we do last? Or how, do we have to repeat things sometimes? What are we doing with our waste? Is it categorized properly, or do we need to improve? What about our energy use, our water use, our use of teledentistry? So really owning what's going on inside of our practices and leveraging that to improve our impact on the environment. So the second one is research. We already mentioned oral health outcome research, but there are other areas as well. We can talk about life cycle analyses, where we look at a product or a procedure from cradle to grave. And there's a recent article on toothbrushes, whether electric, plastic, or bamboo toothbrushes, and the life cycle analysis of these, and really develop our evidence base so that we're making sound decisions when we choose materials and procedures. We can look at carbon footprinting. There's a notable study out of the UK that indicated the carbon footprint from the practice of dentistry happens because of transportation to and from the clinic location. Dental education. We'll need to research when we implement climate and sustainability into curriculum, how's it going? What's the most effective way of doing that? And of course, we need to continually develop new materials and procedures that are more and more effective and efficient. The third category was advocacy and policy. Now, I'm not talking about public health policy. I'm thinking more about private practitioner and individual care, where many of our students will end up practicing in that way. When you think of policy, a lot of times it's regulatory. HIPAA, OSHA, amalgam, infectious materials, et cetera, et cetera. But for sustainability in dentistry, what about policy that would encourage us to use responsible, sustainable materials, and policy that might offer financial incentives for taking actions to make our offices and our practices greener, or producing guidelines of best practices that we can share among us as a community of practitioners to choose our greenest practices possible. So those are all avenues to explore in terms of policy and advocacy. And at the end of the day, how do we integrate sustainability into teaching? So our students from our sustainability committee surveyed US dental students, and what they found is US dental students had little or no knowledge, a vast majority of them, of sustainability. However, they thought that it was important as a topic, it was interesting, it was relevant, and it was important to be in their dental training. So the next step is how? How do we integrate it into our training? And I'm suggesting that we look around at what's going on from our colleagues here in the UK medical schools have been integrating sustainability into their curriculum. US medical schools are also integrating this topic, as well as our colleagues in nursing and veterinary medicine. And recently, the group at the Association of Dental Education in Europe held a workshop and produced a consensus statement on how they're looking to integrate sustainability into the dental school curricula there. So we're in very good company, and I'm excited that we're embracing this. And you may know that ADIA has just launched a special interest group on sustainability in dentistry. I am thrilled that this is happening. The chair of the committee is Dr. Yara Berdan, and she's here today also. So I welcome you, and she welcomes you to approach her with questions and discussion today. I'm really thrilled that ADIA is stepping forward with the leadership that we can begin to integrate this topic into our dental school curricula, and that ADIA has created a collaboration, a working relationship with the consortium, and together we're going to make it happen. So welcome aboard. Thank you.
Thank you so much, Dr. Hackley. And I'd like to now introduce Dr. Nilu Tumala, who is the co-director of the Climate and Health Institute at George Washington University.
Thank you, Dr. Sorensen. And as Dr. Hackley said, it is an honor to be here today talking to you all about a topic that is incredibly important to all of us that are here today, but is also increasingly important to the field of medicine. So we really appreciate being invited today, Dr. Chen, for your support. And my talk today is gonna build off of a lot of what Dr. Hackley said. I'm an ear, nose, and throat physician at George Washington University, and I'm gonna sort of give a 360 view of what I view health professionals can do to really make an impact in this area. So this is a schematic we've seen a few times. It's from the CDC, and I'm not going to go into detail on it, but it really highlights how the 4 climate variables have a myriad of health impacts. And so the 3 pillars of work in terms of what we can do as health professionals is research, advocacy, and education. So research, there's a lot of different areas that we can think about. Dr. Hackley really focused on some of the dentistry-related areas and what really pertains to the field of medicine in terms of life cycle assessments and carbon emissions. And just when we think about this on a global scale, a lot of the areas that are being looked at are air pollution, environmental inequities, occupational health hazards, extreme weather events, and then of course, sustainability in healthcare. So I tend to talk to my patients a good amount about climate change and health. And the reason I'm able to do this is because we have good research. And so as an ear, nose, and throat physician, I care a lot about environmental allergies and allergic rhinitis. And so I can tell my patients that global warming has been linked to lengthened growing seasons, pollen growing in new geographic regions, and increased concentration of pollen in the environment. And I can do this with authority because we have the studies that show us that in North America, the pollen season is about 3 weeks longer now than it was 30 years ago, and that there's about 20% more pollen in the air. So I say this because I think one of the challenges that we face as health professionals is how do we talk to our patients about climate change? And it's the research that really gives us the basis to be able to make well-informed statements about climate change and health. So this is another one, air pollution and chronic rhinosinusitis. This one has been shown that patients with chronic rhinosinusitis, the risks of that are increased with long-term exposure to air pollution. Again, these are statements I feel 100% comfortable making to my patients because we have this incredible data to support it. So this is a study that was done on tonsillectomies, and this goes back to what Dr. Hackley was alluding to in terms of thinking about different procedures and what is the carbon emissions associated with those procedures, what type of waste is associated. So this specifically was done on tonsillectomies, and what this study looked at was 3 different ways to perform a tonsillectomy. So cold, electrocautery, and coblation. But you could take this same sort of idea and apply it to any procedure. And basically what this study did was it looked at what are all of the materials that were used for this procedure? How long did it take in the operating room? And so basically they came out with what is the most sustainable way of performing a tonsillectomy. What I think is really important, though, when we're doing this research is not to say that just because something is most sustainable, that that's the safest for that patient. If a clinician's not comfortable doing a procedure in a certain way, of course, that takes precedent. But when we have data like this that tells us if two things are seemingly the same and one is more eco-friendly, it may be worth considering that method versus another. So I'm going to switch now to advocacy. And here's a couple of really great organizations that are doing a lot in terms of climate change and health. So as an ear, nose, and throat physician, I got involved in this work about 5 years ago when I was graduating from residency. And since then, there's been 4 main areas that I've really been focusing on. So one was education. That's me. I had to educate myself first about climate science, about sustainability, before I was able to talk about it with other people. So I think it's worthwhile sometimes to consider taking a climate science course online. I took one from Michael Mann, very easy course. It was like one of the edX courses. But I think sometimes just having a baseline knowledge of these things can be helpful. You don't have to have it. But if you were like me who knew nothing about greenhouse gas emissions, it was helpful. Creating a network. This was huge. When I first started, it was challenging for me to find clinicians who are interested in this. Now we have this incredible rich network of clinicians, and we know that at every institution, the more people you have talking about it, the more likely leadership is to act on this. Advocate on every level. So as Dr. Hackley was talking about more of advocating on a personal level, this is more policy. Thinking about what is our voice as health professionals and advocating any way that you can, and then be experimental. One of the things that I've really embraced is opinion piece writing, really trying to connect directly with the community to tell them how is it that air pollution and climate change are impacting their health, and why is it that I, as a health professional, care about this, and why I want them to care about it as well and advocate with their legislators. So this is a study that was done in JAMA a couple of years ago. And the only reason I bring this study up is because it really shows that with lower levels of air pollution, the incidence of asthma went down. And this was done in JAMA, and it looked at 4,100 children, a really robust study. So I was able to take this information and talk to policymakers about why improving air quality is so important to health. In this specific study, decreased risk of asthma. And so one of the things that I think that we can also do as health professionals, beyond looking at our own carbon footprint and our own emissions within our practice, is really getting engaged, as comfortable as you feel doing so, with our patients, our families, and then also reaching out to elected officials to talk about why this is such an important health issue. And then finally, education. Of course, this is why we're all here today, and it's something we've heard a little bit about already, and I think there's 4 main areas that we can focus on: students, healthcare colleagues, healthcare leadership, and patients. Students really are leading the movement for change. We hear a lot about the youth movement and climate change, and within the health community, students are no exception. At GW, it was students who really led the integration, which we just got approved, to have climate change integrated into the 4 years of medical education in a longitudinal manner. And so I think any students that are here today, your voice is going back to your medical or to your dental school curriculums and talking to them about why it is important to you. You know, we saw the study that shows that this is important to students. Your voice has tremendous value. Educating colleagues. There are so many times where I'm in the surgeon's lounge and someone will come up to me and say, Nilu, what is that thing that you're always talking about? Tell me about climate change. Why do you care about this? There is a paucity of information in terms of educating healthcare professionals or healthcare professionals who really know and understand what is it about climate change that is so vital for healthcare professionals to be talking about. Why is it important to health? But then also, what is our carbon footprint? Why is healthcare, as we heard earlier, contributing to 8 to 10% of heat trapping emissions? And so, this is just a very simple study, not simple, sorry, this is a very simple schematic that really just shows what are the operating room emissions. And this is looking at 3 different hospitals, one in Canada, one in the US, and one in England. And so I include this because just using information like this to tell your healthcare colleagues, okay, desflurane has a much higher carbon footprint than sevoflurane, and really just trying to get people to understand that everything we do in patient care does have an impact in terms of having waste associated with it and carbon emissions. So again, we want to prioritize patient care. That's number one. And there's definitely emissions and waste that's necessary to have good patient care. But sometimes, again, there are apples and apples we can exchange to be able to lower our carbon footprint and decrease waste. Educating leadership. So this is, again, when you have leadership on board, this is how you're going to be able to make change within your hospital system or within your own practice. And so really talking to and educating leadership on why this is important to you as a clinician, why is it important to your patients, and then also what are the cost savings associated with a lot of these different measures, because there are really great economic savings. And the Practice Green Health website that was mentioned earlier does really show what you can take to leadership to say, if we change this out, we switch to LED light bulbs, maybe we can save this much money. And Scope 1, Scope 2, and Scope 3 emissions is just a way to sort of break down some of the emissions that are related to the healthcare workforce. We are trusted voices. And so this is also something that I feel very strongly about, that when we talk about climate change and sustainability and why this is important to us, why this is important to health, then this is an area that we can really get, again, our colleagues, leadership, and our patients acting on. And so I think within this, we're number 3 now. We used to be number 2. This is from 2022. But clinicians are number 3 in terms of having a trusted voice. And so this is not something we take lightly. And again, that goes back to why we need the research to be able to make substantial statements about climate change and health. But once we have that research and we educate ourselves, then we're really able to educate others, which is what we need to take action on this. There's so much going on right now, and this really is the time to have the momentum to act on climate change, to incorporate climate change into our education system. And really, again, the 3 areas that I think are most important to focus on are research, advocacy, and education. And if anyone here is at a hospital system, I would inquire to see if they're a part of the HHS pledge that was just put out this past year. And that's it. Thank you.
Thank you so much. We are just so delighted to have 2 incredible leaders such as yourselves here talking to us about this really important issue. So we have a couple minutes now. We want to hear from you all out there. We have 2 mics set up, and if you have any questions or thoughts you'd like to share, please step up to the mic. And I'll just get things kicked off a little bit with you two, just kind of start some questions here. So, we've been seeing tremendous momentum building nationally and internationally around climate change and health. The National Academy of Medicine has a grand challenge right now on health system decarbonization, which has been incredible to be part of. We heard this morning that the ADA has sustainability baked into its future vision. We have the ability to sort of see these large institutions move, but as individuals, what can we do at our institutions? So maybe, Donna, if you could sort of tell us a little bit about the work that you're doing at Harvard around climate change and health.
Great, thank you, Cecilia. And so, first of all, we have our sustainability committee, and it's made of students and driven by students, but it is also multidisciplinary. So I think that is key. We have a facilities and operations person, we have our procurement person, we have a dean of students, we have medical school representation, faculty. So it really takes the whole community working together to be able to launch some of these initiatives. And frankly, I have been doing presentations and lunch and learns at a variety of schools, and it's usually students who request and attend these presentations. And they're passionate about it, and they know the importance, and they want to move forward. But honestly, in building sustainability committees at our schools, they have to be multidisciplinary so that there are people with authority on there who can actually implement these changes. That's one of the key things that we have going on right now. And we have some research going on as well. We have a study going, looking at our transportation at our school, and we'll try to assess our carbon footprint and also find ways that we can reduce that carbon footprint. We also have just produced a small module for the Global Health Starter Kit. It's module number 6 on environmental health. It's designed for oral health educators and oral health students, and it's a nice introduction into the concept of oral health and environmental health and sustainability in dentistry. And another study we have is measuring the impact of that particular course, and that's how we're beginning to insert it into our curriculum, in that we share this module in both the undergraduate level at the Harvard College, at the dental school level for the pre-docs, and at the postdoc level with our DPH program. So those are a few of the ways that we're trying to make progress. Thanks.
Thank you so much. How about you?
No, that's great. At GW, we formed a Climate Health Institute, which is really, it's pretty young. It's only a year and a half old, but we're really doing the same sort of idea with a cross-disciplinary approach. So not just the schools of medicine, dentistry, nursing, and pharmacy, and public health, but we're also trying to incorporate the schools of like engineering, business, law, to really, again, have this sort of 360 approach to climate change and health. And so within that, we do the 3 pillars of research, education, and advocacy. And so as I mentioned, one of the things that we just got approved is incorporating climate change into the medical school curriculum longitudinally over the 4 years. And one thing I will say, if your institution does not have a sustainability center already, or if you're having a little bit of trouble finding a network within your academic institution itself, there's also a lot of really great state-based organizations that allow you to have a little bit of sort of a home with other clinicians. So in Virginia, we have Virginia Clinicians for Climate Action. And again, that includes a lot of students, but then we also do have dentists, pharmacists, nurses, and physicians, and allied health professionals as a part of that. And so you're able to learn a little bit more about what the state is doing and what universities in the state are doing. And I know Georgia has one, Florida, California. So there's a lot of states that have these state-based clinician organizations that might be a good starting point.
Thank you so much. And we have a question from the audience here.
Yeah, I was glad that Harvard's looking at the commuting time and getting people to and from the campus. My school has between 800 and 1,000 patients every day coming in, which is a lot of carbon to get those people there and back, let alone the staff. So what about telemedicine, teledentistry, and more point of service care so that people don't have to drive 50 or 100 miles for the care they need? Do you think that great patient care and reducing the carbon footprint can work in common, work together?
Yeah, that's a great question. That question was regarding, we see so much of the carbon footprint in dentistry going towards transporting patients to and from clinic appointments. And so can we still provide good oral health care with telemedicine? Did you have thoughts on that?
So within ENT, I use telemedicine sometimes, but there's a lot of limitations because it is a specialty that, you need to be able to examine someone's mouth or, someone's ear if they're having specific complaints. I think there's a role for it, especially like going over results or imaging. I think, at a larger scale, trying to use telehealth as much as possible for certain like talks and lectures and conferences, things where patient care may not be compromised within academic medicine. But I think, unfortunately, for ENT specifically, there's some limitations.
And then we can also look, during the time of COVID when patients weren't able to come in and we weren't seeing them, where there was a big use of telemedicine and teledentistry. So I would say that we look in that direction and find what was effective, what was safe, and leverage those experiences and bring something good out of the COVID experience. And also, for example, in pediatric dentistry, many times if it's a complicated treatment plan, we don't design it on the fly the day that we obtain all of the diagnostic information. Following up with the families is an option to be doing that remotely.
Yeah, absolutely. And as you mentioned, sort of, if you have a family that needs general dentistry care, bring them in together, right? Try to sort of make it easier for the family and make it easier on the earth. So thank you so much. So we're going to turn it over now to the Mentimeter. If you're familiar with this, good. If not, no worries. So what you do is you pull out your smartphone or your laptop and you go to www.menti.com. And there's a code here at the top of the screen where you type in this number. And then we'd like you to you have a little text box there where you can answer this question. What climate impacts on health have you seen in your community? So it's menti, MENTI.com, and the code is 73435416. So we'll give you guys a couple of minutes to take a look there, and we'd love to hear from you. So menti.com, MENTI.com. 73435416. You know, it's interesting. I'm an emergency medicine doctor, and where I was practicing in Colorado, we had this horrible wildfire season, and it was the height of the COVID pandemic. So we had patients coming in the doors, 24/7, complaining of shortness of breath, with a COVID pandemic and severe wildfire smoke, and just sort of thinking about, how we were going to manage, these two emerging issues kind of colliding at the same time was really challenging and interesting. So we're seeing some great responses from you guys. What impacts have we seen? Autism, infertility, allergen shifts, allergies, poor air quality, health disparities, more traffic as a result of more power outages due to bad weather, more air quality, allergens, water quality, wildfires. People are seeing climate change in sustainability centers, which is fantastic. People are seeing more extreme weather. We're seeing higher risks for medical emergencies, more children and adults with asthma, more allergies, air quality issues, absolutely. Health disparities, decreasing fish populations, absolutely. Attention problems, autoimmune diseases, maybe people have asthma and the smog makes it worse, absolutely. Allergies, pollution from transportation, weather-related cancellations, extreme weather, tornado impact of COVID-19 within 2 months of each other, right? So we're seeing sort of those converging crises, increased respiratory issues and eye issues, worsening COPD in patients, weaker immune systems, overwhelming mental health burdens, awareness of patients on issues related to this. People are seeing some awareness. We are seeing increased advocacy, smoke, pollution. You guys got it. Thank you so much for sharing.
great.
Endocrine disruptors, absolutely. Okay, all right. Thank you for your participation. I'm glad that worked. Okay, so next I'd like to invite our incredible students to come up and join us here. We have Ethan Madison, who is a senior dental student at the University of the Pacific. We have Ibeth Morales Acosta and Ashley Arun Pradeth, who are both senior dental hygiene students at the University of the Pacific. And joining us remotely is going to be Tiffany Huang, who is a senior dental student at UCSF School of Dentistry. We would have loved it, but she is taking her ADEX exam. So each of these students is doing incredible work at their institutions. And first, we are going to hear from Tiffany. She pre-recorded some comments to share with us today. We asked her for her to tell us her story. Why does climate change and environmental health matter to her as an oral health professional? So let's hear what she said.
I grew up visiting the many national and regional parks in California. This gave me a keen sense of how precious the environment was and what it meant to be a steward of it. After earning my undergraduate degree, I volunteered for the AmeriCorps Service Program, planting trees with an urban forestry nonprofit in the Bay Area. Through that experience, I learned the importance of grassroots climate change advocacy. Since starting dental school, I've been inspired by the incredible community of healthcare professionals who are working together to confront the climate crisis. I came to realize that as clinicians and oral health providers, we have a responsibility to mitigate the impact of the climate crisis on the health of our patients and communities. This is a picture of our dental clinic during the 2020 California wildfires. For me, it serves as a stark reminder of the urgency of the climate health crisis. Throughout history, students have been at the forefront of change and progress. And now as a student, I realize that we too have a place in the climate conversation. And it is time that we start speaking up.
Okay, so then we asked Tiffany to tell us about her current initiatives to address climate change at her institution. So let's hear what she said.
In 2020, 2 of my classmates and I created Green Teeth, our school's first sustainability-oriented student organization. Our goal is to fill the gap of climate action in dental education and to help focus and redirect environmental interest into action within our profession. For one of our larger projects, we spearheaded implementation of our pre-doctoral clinic's first recycling program. This introduced normal paper and plastics recycling, as well as special materials, soft plastics recycling, into our pre-doctoral clinics for the first time. And thus far, the program has diverted over $25,000 worth of soft plastics waste from the landfill. This is a photo of our intrepid recycling program manager, Daniel Chow, who has been instrumental in making this happen. In addition to this, we host a number of events to engage our community in environmental stewardship, ranging from community gardening events that you see here, to hosting educational seminars, to collaborations with other dental school green teams. Currently, we're working on the dental school adaptation of the Planetary Health Report Card, which is a report card style metric designed to evaluate health professional schools' commitment to planetary health. Our hope is that this can help catalyze institutional change and interprofessional collaboration on a much wider level.
All right, and then lastly, we asked Tiffany her thoughts on how oral health education and practice should change.
Planetary health is an emerging conversation, and I believe that more research is needed to better understand how the climate crisis affects our patients and how our practice, in turn, contributes to its exacerbation. Hopefully, this research will help us form an evidence-based framework for which we can develop sustainable best practices. Climate change is a complex problem, and tackling it will require all of our combined expertise and energy to integrate these best practices into research, education, and patient care. As powerful as grassroots advocacy can be, I think that it is so important that our institutions invest in this conversation and encourage faculty interest and support student initiatives. Our oral health education needs to acknowledge the health impacts of climate change on our patients, as well as incorporate dental waste management into our education. As for the oral health practice itself, I believe that preventive dentistry is the most important way in which we can reduce the environmental burden of the field. The core of preventive dentistry, which is reducing the burden of disease and the subsequent treatment provided, is essential to the mission of climate-conscious dentistry. Climate change and its profound human cost requires long-term and sustainable solutions within dentistry, and prevention and maintenance of oral health is key to that.
All right, well, let's all say a silent prayer for Tiffany as she takes her exam, I think today or tomorrow. And I'm gonna turn it over to Ashley and Ebeth. I'll give you guys the pointer here. And, same questions, tell us your story. Why does climate change and environmental health matter to you as oral health professionals?
Hello, everyone. My name's Beth, and climate change matters to me as an oral health professional because I want to be part of something bigger than myself. I did not grow up receiving essential healthcare services such as dental and medical due to the lack of health insurance and language and culture barriers. I also didn't grow up knowing about sustainability and the impact it can have on my health and others around me. So I realized that because I did not have the education about such things earlier in life, I did not care about them. However, I also realized that you can't care about something you know nothing about. So what helped me see the value and impact in somebody else's culture was going to college and having meaningful discussions. In the fall of 2019, I was part of a hands-on growing sustainable food movement at Portland State University. Through this community engagement, I saw the need firsthand to make a change and was motivated to foster others with a sense of responsibility to care for the environment with the power of education.
Hello, my name is Ashley, and environmental health matters to me because it affects everyone. I pursued a career in dental hygiene because I wanted to contribute back to my community. I grew up receiving this care, so I understand the importance of providing this care. I relate this experience to climate change because education is important and everybody has a responsibility. The photo on the left is a photo of my brother and he motivates me since he currently suffers from asthma. And the photo on the right shows a world map with the black circles representing how much gas emission was produced by each country in 2021, and it shows that the United States is a big contributor to gas emissions. Poor air quality is associated with worsening breathing conditions and respiratory illnesses. If carbon footprint keeps increasing, this will have negative lasting effects on our patients and our loved ones. As providers, we may see a higher incidence of medical emergencies in our dental operatories, as well as the profound gap widening when it comes to health disparities.
Thank you both so much for sharing your stories. Now, I know you're so busy and you have all these incredible initiatives going on in your institution. Please tell us about them.
So when thinking about the environment, one of the first things that our institution looked at was waste management. The picture on the left shows waste accumulated at the end of a clinic day. A student-led initiative that was strongly supported by administration led to the implementation of EnviroPacks. These are sterilizable pouches that can be used a minimum of 200 times, which reduces cost and excess waste. They are used to wrap hygiene and restorative cassettes, prophy handpieces, and ultrasonics tips. When we challenged ourselves to be more proactive with our strategies, we expanded on telecommunication and collaborative work practices. The literature mentions that the most significant contributor to the carbon footprint in dentistry is the transportation to and from the clinic for patients, staff, and providers.
At our institution, we try to effectively utilize an appointment so the patient does not have to come back another day. We utilize telecommunication by having our patients fill out a medical history form via email, and we will call our patients prior to their appointment if it's not filled out. And lastly, we review their medical history when the patient is sitting chairside. This creates a more effective process. We also fill out faculty logs so our faculty can help us set time goals to make sure we complete treatment in a timely manner. In addition, we communicate closely with our front office to schedule family or partner appointments at the same time so they are able to carpool and reduce carbon footprint. Co-creative student, faculty, and administrative efforts result in significant environmental and sustainable strategies.
You guys are incredible. Thank you so much. One last question. How do you think oral health education and practice should change? How do you see the future of this?
So we propose that sustainability be taught in school to implement change before health professionals are out in practice. According to the literature, early exposure is more effective and builds a stronger buy-in foundation. So you cannot care about something you know nothing about. So it's our responsibility as lifelong learners in a room full of educators and students to educate ourselves and place a value on matters regarding climate change.
This is a public health issue, and we must engage in conversations and work together to combat climate change. The why is going to look different for everybody. It's questioning ourselves and answering the question, how am I going to be sustainable in my practices, in my teaching, in my everyday life, and incorporating that into the culture of the institution. Every small step counts.
Thank you both so much. Now over to you, Ethan. Tell us your story.
So what got me interested in improving practices in the context of oral health care was the stark contrast between the amount of waste I generate in my personal life versus that in clinic. At home and about, I throw something in the landfill about a handful of times a week. In clinic, I personally throw about a couple hundred items per week away, at least half of which are gloves. That got me wondering what we can do better as a profession to quantify the problems. 20% of medical waste is single-use plastics, and only 15% of healthcare waste is actually classified as hazardous. Those statistics suggest there's much room for improvement. From another perspective, the problem to which we are contributing may be worse than the problems we work to solve. Air pollution-related deaths alone currently number more than 4 million per year. Climate change will be the greatest killer of our times if we allow it to be, with worsening disasters, droughts, and famines. And finally, as healthcare professionals, we pledge to do no harm. It is against our code of ethics to contribute to asthma, housing insecurity, infectious disease, and all of the other harms we mentioned earlier.
Thank you so much for sharing, Ethan. And I know you're doing some incredible work at University of the Pacific. Can you tell us a little bit about it?
Yeah, I'm part of two main initiatives at my institution right now. The first is our Student Association for Sustainability and Green Dentistry, which brings together students with an interest in minimizing their environmental harm. The main focus of the organization is education through lunch and learns with local dentists and experts who emphasize harm reduction. The second and newer initiative is reforming an official committee at the school which will empower students, faculty, and staff to set goals and make changes to better our practices. For those wondering, all it took to get the ball rolling on this was an email to Dr. Nader Shahi, so thanks to him.
Awesome, thank you. All right, I'll grab that clicker back from you. And we want to hear from you guys out there again on our Mentimeter. So if we could pull up the Mentimeter. And we'd love to hear from you. How have you begun to integrate sustainability practices into your work, home, or community? Share your ideas. I think this is really sort of a creative process, and there's no one-size-fits-all solution here, but we'd love to sort of have you share your ideas. What do you do on a daily basis in your personal life, maybe in your communities, maybe in your practices or at your institutions? So again, it's menti.com, menti.com, and the code is 73 43 54 16. Okay, so we have people recycling, doing compost, mobile clinics at Pacific University, biking and walking school, awesome, you get exercise too, recycling all plastics, paper, and cardboard, growing their own veggies, turn used clothes into new clothes, being conscious of water, manage food and waste differently, try to use items that can be reused, organize recycling system at home, live close to where you work, recycle plastics, no disposable dishes, the LOL program, drive a hybrid, carpool, reusable water bottles, food containers, etc. Another person lives close to work, jealous. Using public transportation instead of owning a car also saves you a ton of money. Having electric vehicle and yard-powered, I'm guessing, equipment. Being part of a community garden, lights off at lunch. Okay, there we go, thank you. Reusing preclinical gowns, eating less meat, taking the bus, mobile dentistry, recycling, not using plastic bottles, having an e-car and recycling. This is amazing. Shifting away from single-use water bottles and plastic silverware. Preclinical recycling bins, reusable bags at grocery stores. On-campus garden with education. Fantastic. Using solar energy. Having a hybrid car, driving hybrid. Fantastic, everyone. Wow, we've got a great group here. Biking, remote work. I love remote work. Turning off the water faucet while you're brushing the teeth. There you go. We can say that in every dental clinic, right? Okay, LED lights, walking when I can, more efficient scheduling to reduce waste and redundancy, shopping at waste-free bulk stores, carrying water bottles everywhere. That's important. Okay. You guys are amazing. Medical history via teledentistry, hydro flasks, carpooling. All right. Very awesome group of people in this room. Thank you all so much for sharing. So let's go back here. So I've got a couple questions for the entire panel, and we invite you to come up to the mics again to see if you have any questions for our group here. So I'm going to start off with a question for Ashley and Ebeth. How can students get involved or start climate and sustainability initiatives at their own institutions?
So we believe in the importance of engaging in conversation and advocacy to promote change. Students can also consider asking institutions, companies, and future employers what they are doing to combat climate change. If nothing is in place, then it is an opportunity to create that change. It only takes one person to make a difference.
Like your email.
Yeah.
If there are current initiatives, it is an opportunity to support and expand on them, as well as bring in new ideas. For example, at Pacific University, students brought forward a clinic assisting internal rotation where we not only learn from each other, but we also reduce the use of gloves and other materials without the clinician having to leave their operatory.
Great ideas. And Ethan, question for you. What's your message for those who say, I'm just one person in my institution, how can I possibly make a difference there?
So I think the real message is don't be just one person. Get organized, copy the initiatives we've talked about, and reflect on areas for improvement in your institution and personal life. Empower decision makers at your institution and wield your power as a leader, an educator, healthcare provider, and a community member to do good. Start conversations and make your interests known to local politicians and institutional leaders.
And local media, I would say, because they love these stories. They will come out, they will take your picture, they will interview you, and that's another great way to kind of get the word out. We have a question from the audience. Please go ahead.
Thanks for sharing all of your experiences. So for some of us in the back who are wondering sort of what were the steps you took initially to get started with some of these initiatives? And one of you talked about getting leaders on board. And so how did you do that and what was their initial reaction to some of your initiatives?
That's a great question. Ethan, go ahead.
Okay, so the two initiatives I talked about. So one of them, the Student Association, was already formed. I had no part in forming it. And I just joined as a member and one of the leaders in the organization. And so what I try to do is invite speakers to come in and help us get educated. Secondly, I reached out to the dean knowing that he has an interest in climate and sustainability and asked him to start this the committee at the school. He roped in the appropriate people and we've been going since then.
Great. So find your friends and then reach out to your dean. But sometimes it's not that easy, and I think maybe there's other barriers. So Dr. Hackley and Dr. Tamala, do you have any wisdom to share about how to really engage institutional leaders in this? So once you found your friends, and you're like, okay, we're going to do something. We have all these ideas. What's the most effective way to identify the right leadership person and to approach them about this?
We've been fortunate that the people who have joined our sustainability committee, and I neglected to mention our lab technician, and we also have lab representation on there, we're like-minded, and the group is willing and empowered to make changes, including recycling, composting, reusable mugs. We have a lot of various initiatives, and some are more institutional, like temperatures of freezers and how often the fume hoods are running in the labs. Is it necessary? Our computers are shutting down at night when no one's using them. So we're fortunate that way. And I think many sustainability committees that are made of students right now need to identify, and by discussion and by interest, finding those faculty and those other representatives who can join them in that mission. But I also think, and through now IDEA, this is going to be a great mechanism. The sustainability committees need to be linked together. And we all have, beautiful ideas people are sharing. But if I go to my practice and I'm the one that decides that I don't need the plastic barrier because I'm using, disinfectant wipe and all of this, if I'm not following what the standard of practice is in my community, I'm taking a risk. And we need to look at what is the evidence base, what do we really need to be doing to keep our patients safe, to keep our quality of work, to keep our training at the level that we want it at school, and yet what is not necessary. Why do I have plastic high evacuation syringe tips, high-speed suction tips? Why do I have plastic air water syringe tips? And we throw all that away. Questioning these things, developing our evidence base, and then creating a standard of practice that we can all live by and shift the needle that way. We're shifting the norm. And we've mentioned about networking and research, and I think those are some of the keys.
I agree. I think, you know, I live in a progressive city in DC, and I have still met a lot of challenges when approaching certain components of hospital leadership. I think some of the things that have helped is, one, talk about what universities in the area are doing, right? If you're at an academic institution, a lot of times they're going to want to be the one leading change. So if you talk about how universities in the area already have sustainability committees, that might be one way to get hospital leadership on board. Two is sometimes approaching the conversation, not using the words climate change can be helpful. So either using the words sustainability or say that this is an economic incentive. So one of the things that we did was not having, this is obviously specific to inpatient hospital care, but not having meat on patient trays. And so that is a conversation you can have purely from a cardiovascular health standpoint. But of course, as one of the responders said, cutting back on meat has a huge sustainability component as well. And so really thinking about what are some of the angles that might resonate more with leadership. And again, if I have no financial incentive for Practice Green Health, but their website does do a good job of showing how you can monetize some of the savings with some of these sustainability initiatives. So it might be a good place just to get a little bit oriented and educate yourself so that you can then take these conversations to hospital leadership.
I agree. I think the economic argument is important, and we actually have it on our side in a lot of ways. You know, when you reduce environmental carbon footprints, it often ends up saving hospitals and health systems and even, you know, educational institutions money, right? So we actually have that on our side. So, you know, talking to the heart, the mind, and the money. And I think that, you know, we have all those arguments sort of laid out, and that's a sort of piece of what we need to do as internal advocates. So a lot of exciting stuff. Any other questions? Please go ahead.
Thank you so much. This has been great. So we've heard a lot from you guys as students, so we appreciate that, and also just what you just said about talking to leadership. But as a faculty member, what are some other things other than what you've shared so far that are real and practical to start this work in climate health in our own institution?
Go ahead, John.
So I can just offer like a bit of my own personal journey. I just started noticing, and it became something that I wanted to learn more about. And a couple of places where information is readily available. I mentioned the starter kit. There's also the World Dental Federation. You can sign up for free. You just register and have free access to a toolkit that they've created with ideas, both for institutions and for private practices. So that's a great resource. And, you know, there's a website that I think is tremendous. It's called health2016.globalchange.gov. Where am I getting that? health2016.globalchange.gov. And what I love about that, and it helped me to understand and articulate to others, and I inspire others to begin to move this needle. They'll take an exposure pathway, and a health outcome for like the image that you've been seeing on the screen, the spiral image, and break it down and show you the research and really help us to understand how health is affected by climate. But it also takes into account the concept of equity. And we know that globally, we're not all producing the same impact on the environment, and we're not all going to experience climate change equally. And there's a tremendous amount of inequity in that. And, you know, environmental justice is a key piece of this discussion as well. So I want to make sure that we recognize that. And especially as a nation, we produce some of the highest per capita CO2 and the greatest volume of CO2 globally. And being a developed nation, we're the least likely to experience the effect of that. So really, it's a moral hazard, and I think we're called in that regard as well to take action.
And I would say, we have a huge opportunity right now, and I think as faculty, you're so busy, you're designing curriculum, you've got to meet all these criteria. And one thing I would just urge, as ideas coming into this space is that each of you should not have to reinvent the wheel. So one of the things we've been doing at the Global Consortium, and I think one of the best things about it, is that we bring together institutions to share resources, right? So we're all kind of teaching similar material to the same standards. We don't need to create 500 different slide decks which say the same thing, right? We can create one, make it really good, and everybody can use it. And so as we sort of grow this relationship with IDEA, with GCCHE, one of our hopes is to be able to create these resources that can be easily kind of put into the lectures you're already giving, so you don't have to sort of be all alone out there kind of trying to wrangle with all this material. So I would encourage you to join the special interest group, to be part of the creation of this, and to find your friends there, because I think that we can move a lot faster if we work together. So I think we have time for one more question.
So yes, thank you all for bringing this conversation to light. Climate change and sustainability is something I'm very passionate about, and I've gotten some great ideas from all of y'all. I'm from third year from Houston, and on the way to the airport, on one of the flyover bridges, the smog and the haze of Houston, it was, I don't know, it kind of tore me apart. So I appreciate this being a topic. So just something practical. I think that recycling is a very practical and visual way to just get the foot in the door of sustainability. So like, who picks up the recycling? Did you have any barriers with like OSHA or EPA requirements? Because I know like a lot of recycling materials, you have it in a recycling bin, and where does it actually end up from there? So I know waste management kind of, you have to pay them, and just kind of how does the actual recycling process work at your school?
Yeah. That's a great question, because, recycling is good and we should do it, but more important than recycling is not using materials that we don't need, because any processing of waste does take energy, and we know that recycling doesn't always end up getting recycled. So, thinking about sort of reducing what you're using is kind of the first piece of that. But wondering if anybody has any insights on sort of the regulatory environment around recycling and any barriers we've faced to that.
So I can answer a little bit of that. So I know TerraCycle offers a glove recycling program for clean gloves, so meaning they haven't been contaminated by bodily fluids. So I think that's a great program to think about for sim lab gloves, or kind of your models lab, where these gloves aren't getting used to touch people. They're just touching clean things, and you can recycle those no problem. And they'll take care of those and turn it back into not new gloves, but other things. They don't specify exactly when. So that's one option.
Any other thoughts?
Yeah, just to kind of go back to, again, recycling is important, but it really is reducing the amount of waste that we're producing. And so, within our ENT clinics, we used to have like every single instrument peel packed, like all the little mirrors that we used to look in the mouth, the suctions that we used for the ears, everything was peel packed. And it actually turned out that our ENT Academy had put out a statement a couple of years ago saying that there's actually no difference in infection control rates between whether you just have the equipment sterilized and then put into the drawer versus individually peel packed. And so that gave me some motivation to be able to go to the clinic, and when I give grand rounds at other ENT departments, to say you don't necessarily need to have each instrument peel packed. And so I think, there are sometimes also infection control is such a big part of waste production. And of course, infection control is of paramount importance to patient care, but there are definitely things that we're doing that may be unnecessary and not actually improve infection control. And so again, when we have more research on these initiatives, it'll be helpful to reduce the amount of waste we produce. But that's just one example. And if anyone's interested in what our academy put out on that, I'm happy to send it your way. But again, it's just showing that reducing is really key to the future we're hoping for the medical profession.
Absolutely. Thank you all so much. All right, well, we're reaching the end of our time here, but I just want to give a huge thanks to IDEA and to everybody who made this event possible. It's really exciting that IDEA has joined the Global Consortium on Climate and Health Education. This is the first dental association in the world to join on to our organization. So we are just delighted for this. I think this is going to be a tremendously fruitful collaboration. We plan to work very closely with the special interest groups. So if this is anywhere on your radar, please, I've been told you go to your member profile and you can sign up to be part of the interest group, because that's where all kind of the juice is going to be happening. Just a little background on the Global Consortium. We were formed in 2017 at the UN Conference of Parties, and our mission is to ensure that 100% of health professionals globally have the knowledge and skills to recognize, respond to, and prevent climate-related health impacts. It's wonderful the AD has joined us. We have over 300 members in over 50 different countries. So if your dental school wants to join, we invite you to join, to take this pledge, to train your students. If you haven't started, or even if you're halfway there, do join us. We have a lot of courses to train faculty. We have opportunities for students, and so much more. So as just a reminder, we're all in this together. And I think, they say if you want to go fast, go alone. If you want to go far, go together. And so I'd say let's go together, and look forward to seeing you all soon. Thank you very much for being here.